This morning, we turn our attention to an issue that touches the very heart of our national well-being, the looming industrial action by resident doctors and what it means for the future of healthcare delivery in Nigeria. Now, just days ago, the Nigerian Association of Resident Doctors, NARD, issued a fresh ultimatum to the federal government, warning of another strike if long-standing grievances are not addressed. Now, from unpaid salary arrears and delays in the 2025 Medical Residency Training Fund to the bureaucratic bottlenecks in career progression, the doctors say their patient has run thin. Now, the situation is deranged at the close of their recent National Executive Council meeting in Calabar. The NARD President, Dr. Osundari Tokpe, painted a grim picture describing how the health sector is bleeding talent, while leaders continue to seek treatment abroad. According to him, this isn't just about salary structures or allowances. It's about professional dignity, respect for collective bargaining agreements, and above all, saving Nigerian lives. The doctors are also demanding reforms to end the devaluation of their qualifications by key regulatory bodies like the Medical and Dental Council of Nigeria, and are calling for better governance in our federal hospitals, many of which are currently without functioning boards or management. And it's not just at the federal level. Across states, from Oyo to Kaduna and most recently Lagos, medical practitioners are also raising their voices. In Lagos, the medical guide has begun a 3-day warning strike, citing illegal salary deductions and non-payment of reversed allowances. While the government insists it is engaging with the unions in good faith, the tension is palpable and the lives of ordinary Nigerians, as always, hang in balance. So how do we get here? What can be done to avert yet another crippling shutdown of our hospitals? And what's the real cost in lives and national development of failing to fix our health system? To help us unpack all of this, we're joined by Zoom from Bauchi this morning by someone at the very heart of these negotiations, Dr. Abdulrauf Tajudeen, the first Vice President of the Nigerian Association of Resident Doctors. He's also a Senior Registrar in the Internal Medical Department at Abubakar Tafawa Balewa University Teaching Hospital in Bauchi. Thank you so much, Dr. Tajudeen, for joining us this morning. Welcome to Daybreak.
Thank you, Mel. Thank you. And thank you, viewers.
So, let me start by asking you, how did we get here?
Thank you very much for that question. Nigerian Association of Resident Doctors is an affiliate. It's one of the affiliates of Nigerian Medical Association. And Nigerian resident doctors are key stakeholders in every teaching hospital. These are doctors undergoing training to become a specialist. The specialists are those that offer a very specialized care to all Nigerians. And these key sectors, these key areas, these key groups of medical practitioners undergoes training in teaching hospitals, and this training warrants going for update courses and going for exam at designated time during the training until you will be certified as a specialist. This training span 6 to 8 years. That is after the NYC, after the basic medical qualifications. This training is rigorous and is capital intensive. And the government, at the core of struggle in the past, eventually built a law we call MRTA, that is Medical Residency Training Act. And in the act, it specified how the training will be carried out. The National Postgraduate Medical College, the agency saddled with responsibility to design the curriculum and the exams. And as part of the training, as part of the act, a token is also attached to it to help resident doctor as a token of fund to help them every year. This money is sought far below what we spend every year for our training. However, it has been a bane of struggle every year before this money is being paid to the respective eligible members. This year, from beginning, the exam is usually 2 times in a year: April, May exam and September, October exam. Most of our members have written the April, May exam, and we have already registered for September, October exam. These are capital intensive exams. Before you be qualified for those exams, you need to go for update courses. These update courses are being offered in Abuja, in Ibadan, Lagos, and you have to travel. Very few of them are available online that you can do. So you have to travel, you have to get an hotel reservation. These are capital intensive things. So this year, this 2025, government so far have only released 55 to 56% of this money. So only just about 56% have received the money thus far this year. And we are calling on government to, as a matter of urgency, release the remaining balance so that our member that are eligible to go for this exam will be able to register for this exam. Thank you very much.
Thank you, Dr. Tajudeen, for walking us through how we got here in the first place. So let's look at the ongoing recent strike action by resident doctors. Can you talk to us and walk us through the key reasons why the doctors, resident doctors, had to go on strike? What are the key reasons?
Thank you very much. The discussion of the strike currently is not only even peculiar to the affiliate called NAT. The agitation is now general, and it is the Nigerian Medical Association, the umbrella of the entire doctor in the country, that are agitating. Though the core reasons for many members of different affiliates are different, but when we come together, we can see that the health sector is generally bleeding. We are talking of Nigerian Association of Resident Doctor. We are talking of private practitioner. We are talking of dental association. We are talking of medical consultant association. These are affiliates of NMA. Every segment, every affiliate have 1 or 2 things that are demanding from federal government. And at the core is even the infrastructural development in our healthcare, in our hospitals. You will recall recently that we lost one of our dearest former president of this country, and he died in a hospital outside the country. What we are also yearning as doctor, we want upgrade of our infrastructure in the hospital so that all members, including our government officials, can patronize the Nigerian healthcare sectors. And as part of our demand also is there are allowances that are being owed. One of which we call it accoutrement allowance. Accoutrement allowance means it's a token given to us to upgrade our personal instruments, like our stethoscope, award codes every year. The federal government today are still holding us part of 2023, 2024. It's just this 2025, through the agitation, we'll be able to make sure that an element is created on a monthly salary so that the token can be had. So freedom at last, we can say this year that it is actually coming with our salary, but the accrued old allowances are still there to be settled. More so, we are talking of specialist allowance. Specialist allowance is a specific allowance that are supposed to be paid for people who are rendering a specialist care. Just recently, National Salary Income and Wages Commission released a circular. This circular was majorly flawed or go against the norm and the court rule, which stratified the healthcare workers in the teaching hospital into the direct people that have direct contact with the patient and those that are administrative staffs in the hospital. And just recently, the National Salary Income and Wages Commission released a circular giving the specialist allowance to all the cadres of members, workers in the hospital, and even excluding doctors who are even giving this specialist care. And that is why the agitation is surrounded, and there is a total rejection of that circular. And we expect the federal government, just recently, federal government suspend that circular, even though we request for total withdrawal of that circular so that we can go back into the negotiation table, have a collective bargaining agreement, and design our scale, the salary scale, because the relativity which define the difference between the direct healthcare workers and the supportive care workers in the hospital has been eroded with the recent obnoxious circular release, and that has also generated a lot of uproar within the health sector. Thank you.
You made mention of, some of the key factors in which it's driving or is behind the reason why, resident doctors are going on strike. You made mention of, not having adequate medical facilities in our hospitals, and we all know that that is a fact, and then also you made mention of, unpaid salaries and also allowances and some other issues. So now I would love to find out from you, now how bad is, the situation, especially when it comes with unpaid salaries and hazard allowances, particularly in state-run institutions?
Thank you very much. The issue is worse in many states, especially in many states run by state governors. For instance, Kaduna State. In June, as at June, Kaduna State was still paying old salary scales for medical doctor. The reviewed comments has been in place since 2014. This is 2025. 11 years later, Kaduna State government still paying the old rate to a medical doctor. As if that is not worse enough, this medical residency training fund that has been started since 2020 by federal government. This is 2025. Our colleagues working with the state government, both ARD Kaduna and Barao Diko University Teaching Hospital in Kaduna, who are working under the state employment, are still not enjoying these dividends to today. Also, Oyo State, our colleagues in Lautech, Ogbomoso, are facing serious old arrears of salaries. The welfare in the hospital, the call room is a place where you put your heads while you are on call, while you're serving from 4 p.m. to 8 a.m. the following day. This is not conducive at all. Some don't even have the quorum. This thing is as bad as this in all your states. And they are old salaries ranging from 1 year to 3 years, while some are not even, while some are even on the employment, but they have not even received a single salary since that they have been on employment in that state. And we've made effort to reach out to the governor of the state. All our efforts remain futile, and we may be left with no other option than to allow our member to embark on industrial actions if all our yearning are not being listened to. And this is a great opportunity. I will want you, the media house, to help us amplify our voices to these people who are responsible for the payment of all these arrears and allowances.
So,
thank you.
Thank you. It's not just, the NAD that is also affected. We have also the NME where all of the doctors, they recently called off their strike. But then I want to find out from you, because I saw a post on social media where, an individual was narrating his encounter, what he faced when he went to the hospital due to the fact that, doctors were not on ground, the strike and all of that. And then, he was, out of being emotional, he said that, doctors in Nigeria should understand that, we already have a system that does not care for the healthcare, but, doctors are under oath, to save lives, and, they should, kind of not want to use the strike as a tool to, get all of their demands on the table, because it involves life. So I'm wondering, do you really believe that, the general public is fully understands the doctor's perspective, or do you think there's a communication gap between, Nigerians, doctors, and also the government as well?
Thank you. It is important to emphasize at this moment that currently doctors are not on strike. Currently, we are not on strike. And this discussion is part of what we're doing to ensure that the populace, Nigerians, are also educated to know what doctors in Nigeria are going through. And if they have also a link to government, both at state level and at federal government level, they can also help us. We don't want to go on strike. We do not want to go on strike. We want to render our service to people. But unfortunately, as part of our hopes, it is also there that I will attend to my own health and well-being. How will I attend to my own health and well-being? I need to be paid for the service I render as at when due. That is the only way I can even render the service with sound mental health state. So it is incumbent on the populace, the federal government, the state government, to also help us. We are also a human, and we have family, and we have bills to pay. So it is as bad as that. So please, it is not that doctor just want to go on strike. It is far from it. But unfortunately, we have to also take care of our own well-being and welfare. And that is why sometimes it goes from discussion to discussion, from ultimatum to ultimatum. But when the other side is not yielding, the doctors may have no other option than to wield the big stick, which is strike. But we are not strike monger. We are ready to debate. We are ready to discuss. And we are ready to listen to a committed memorandum of understanding. The major problem before is that the trust is not there. between the workers and the government. When we have discussions and we sign MOU, many times the government do not fulfill their own side. And that is where the problem is. Just recently, the entire doctors gave the federal government 21 days ultimatum. The 21 days ultimatum expired 23rd of this month. This weekend, there was emergency delegates meeting. And in the interest of Nigeria, the delegates also, despite that the first 21 days given to the government has expired and the government has not even answered out of 19 demands, only answered one, partially, not even complete, partially, because we request for absolute rejection and withdrawal of the circular, but the government only suspend the circular. But with that, the delegate in their wisdom still say, let's give them another 21 days so that we can further negotiate and see whether we can trust them or not. Thank you.
Dr. Tajudeen, as someone that is, on the very heart of these negotiations, can you share with us the responses of the government, concerning what you, your association, and also the NME as well has, placed on the table for the government? What is their response?
Well, the circular so released destabilized the art sector because the circular eroded what we call a relativity. A relativity is just that if social worker in the hospital are, let's say, medical practitioner, a doctor or a nurse or a pharmacy, as compared to an admin staff in the hospital, if they are on social level, there should be a relative amount that if they are that as a multiplier effect. Let's say if this one is 1, this one should be 1.2 of that one. It's a law. It's a law of Federal Republic of Nigeria. So, and this is what exactly the National Salary and Income Wages Commission did recently. They eroded that relativity. They released a circular that eroded that relativity, and doctors rejected that circular. And instead of them to withdraw the circular, they only suspend the circular for now. That is one of our graphs. Secondly, the MRTF, that is MRTF is Medical Residency Training Fund 2025. As I told you, currently for the 2025, we are now in end of July. Government only released 58% so far. The 42% of our members are still yet to be paid for that. Then specialists, there's a 25-35 comments areas. This comment is our salary scale, but the areas is that when it was reviewed in 2023, it was released in 2023. It's supposed to take effect June 2023, but up till 2024, we are not paid. So it was in March, in February 2024, that they started paying the reviewed comments salary. Then there's arrears between June and December 2023. So this arrears is still there. It's one of our grounds that the government needs to pay these arrears. It's one of our demands. Then specialist allowance. The specialist allowance are just a segment of the salary where it is paid for people who render a specialist care in the hospital. The specialist allowance are being paid to some segments of even people who are not rendering specialist service in the hospital. These people, opticians, are enjoying the specialist allowance. Meanwhile, doctors, majority of doctors in the hospital are not enjoying that allowance. So it beats imagination that it's the doctor that review all the patients that comes to the hospital. We are all, it's a supportive role others are playing, and we appreciate the supportive role. We need to work together, but nobody comes to the hospital to see a pharmacist. Nobody comes to the hospital to see a physiotherapist. Everybody comes to the hospital to see a medical doctor. And it is unimaginable that others are enjoying this specialist allowance while doctors are not enjoying this specialist allowance. This is part of our growth that resident doctors should be paid to be a part of people that will enjoy specialist allowance. Accoutrement allowance areas is there, an upgrade of our facilities in the hospital. When you go outside the country, you meet many of our colleagues there doing fantastically very well there. Our government officials go outside the country and eventually see Nigerians treating them there. We are being sought after everywhere because our certificates can compete anywhere, and we can compete anywhere, but we lack the wherewithal, the instrument to work with. The knowledge is there, but the instrument to work with is not adequate. So we want to encourage the government to help us provide most of these facilities so that we can render state-of-art healthcare in Nigeria. We have people, we have our professors, we have our trainers who are well-trained, who goes outside to go and even offer this specialist service, but they are here. They want to render the service to Nigerians, and we are ready to do that. So we want you to help us encourage the federal government. There is a law that is about to be enacted in the House of Representatives that every public officials and top ranked civil servants should be compelled to use the health facilities in Nigeria and also send their children to schools in Nigeria. And if you are able to do that, if you are able to allow that kind of law to exist, I think we'll all see the turnaround in the health sector. Thank you.
Thank you so much, Dr. Abdulrauf Tajudeen, the first Vice President of the Nigerian Association of Resident Doctors, for helping us unpack the issue at hand. It was such a pleasure to have you on Daybreak this morning. Thank you.
It's my pleasure. My pleasure. Thank you very much.